September is National Cholesterol Awareness Month, and it's promoted by the National Lipid Association. So I'm going to do Pharmacist on the Street and get some opinions about cholesterol and see what people know. Do you mind if I ask you a few questions about cholesterol?
Sure.
So now that you're a P4 student, and I know that you have a lot of experience with medications for high cholesterol, have you had the opportunity to recommend a statin in a patient?
Yeah, all the time. I've done some rotations in ambulatory care clinics. I've done an internship at ambulatory care pharmacy.
All right.
And we recommend them quite frequently.
What's good about statins?
So many things are great about statins. They've been proven to lower your risk of cardiovascular disease, so prevent strokes and heart attacks.
Do you want to help me actually gain some information from people on the street?
Yeah, that'd be great.
Right.
I'd love to
Well, let's go.
Okay, cool. Generally, what do you guys know about cholesterol? Is it good? Is it bad?
Good and bad.
It's good and bad, yeah. There's two types of cholesterol generally. Do you know which types are good and which types are bad?
LDL.
Good or bad?
Good.
HDLs, that's the good ones, and those are the high-density lipoproteins, and then the low-density lipoproteins are the bad ones.
In general, somebody that has bad cholesterol, we want to lower their LDL and raise their HDL. And LDL, we generally target somewhere around 100 or maybe even less than 70 in people that are at higher risk for cardiovascular disease. Tell me what you know about cholesterol.
Oh man.
So if you have bad cholesterol, do you think it's worth providing treatment for somebody that has bad cholesterol?
Yes.
So have you heard of cholesterol?
Absolutely.
Do you think it's something important that we should look at for health?
Well, of course.
Why?
Why? Because cholesterol can clog your arteries.
What's your opinion about people with high cholesterol? Is that a good thing or a bad thing?
It's a pretty bad thing.
What kind of things do you think cause high cholesterol or contribute?
Yes,
Diet?
bad
Okay.
diet.
Bad diet.
Sedentary lifestyle.
So when you say bad diet, what kind of things?
Fast food.
Yes,
Oh,
fried food.
Yeah, fried food.
Fried food. Oh,
Yes.
so what's common about fast or fried foods that you think might be bad?
Trans fat.
Trans fat's one of them, yes?
Yes.
And saturated fat.
Saturated
Yes.
fat, yeah.
Is there any things that you think a patient with high cholesterol should avoid or eat more of from a diet perspective?
I've heard that like maybe 1 or 2 drinks a day can be good, but any more than that is very bad. And probably stay away from, eat more vegetables and fruits and less red meats and fat and things like that.
What type of diet do you think somebody with bad cholesterol should be taking or should be consuming?
Lower in carbohydrates or fats.
We really want them to decrease the amount of saturated fats that they're eating. That can really contribute to an increase in your LDL, which we don't want. So if you have somebody with high cholesterol, what types of drugs are you prescribing to them?
Usually statins.
Have you ever heard of any types of medications that may be prescribed to treat somebody that has high cholesterol? Think of?
Zocor or simvastatin
Good.
is one.
The PCSK9 inhibitors.
PCSK9 inhibitors are sort of special kind of drugs that are monoclonal antibodies. They're not quite as proven long-term as statins, but they are proven to reduce cardiovascular disease.
I know that you know that statins are used as one of our first-line agents to treat high cholesterol. So can you tell me a little bit more about them, like maybe how they work?
Yeah, so they're what we call HMG-CoA reductase inhibitors. So they lower your overall cholesterol levels, but they do so in such a way that the bad cholesterol is what drops the most, and that's why we really like to use them.
What kind of patients do you think of that really need a statin?
I think if patients who already have existing cardiovascular disease, those are definitely the patients who need it the most, but there's a lot of other people with risk factors, things like diabetes, smoking history, those can all contribute to their risk of cardiovascular disease. And statins can really help with that.
We've learned that on the Anschutz Medical Campus, our students, faculty, and staff know an awful lot about cholesterol management, and we dispelled a few myths. In summary, statin medications are used in patients, and they're effective in lowering bad cholesterol, which is that LDL cholesterol. We have HDL, which is a good cholesterol. We like to be as high as possible. That we have dietary interventions, which is reducing saturated fat to reduce cardiovascular risk. And overall, there's a pretty good appreciation that treating high cholesterol or dyslipidemia, hypercholesterolemia, is beneficial for patients' health by reducing their risk of cardiovascular events.